Good morning, everybody. Thank you to those who are joining us online and to those joining us in person. As some of you may know, I'm Tony from McLaren St. Luke's Family Medicine. And as we do the third Wednesday, give a talk on a different medical topic. And today we're going to talk about making the most of your doctor's visit. If none of you have ever been in the military, then doing a doctor's visit is like being in the military. It's hurry up and wait. So, and I've been both, but you know, we think about the process of having to call the office, having to schedule time. We might get in the next week or two. We might get in the next month or two. And then finally getting there, getting checked in, sitting in the waiting room, finally getting our name called to go into the exam room, sitting there for a period of time. All of a sudden, doctor comes in, gone, and you're like, what just happened? You feel like you've spent so much time leading up to that moment, and it doesn't matter if it's primary care or a specialist, that time seems to go very quick. Did I get my questions answered? Did I get the care I need? Do I understand what the discharge plan is? All those things tend to be a blur for some people. And if you're an older individual who doesn't hear very well, doesn't see very well, doesn't have many supports to go with you to a visit, maybe you had to use transportation to get there, you might be a little bit more of a disadvantage because you're not able to capture the full scope of what truly took place. So today, hopefully I'm able to talk to you a little bit about two things. Number one, what you should expect of your physician during a visit. But the other piece of that is, what should the physician be expecting of you? Because it is a two-way street. In order to have good care, you need good communication and good expectations of one another. So first thing you should do is, to me, the most important thing is, how can I prepare for my visit? And I always say, write things down. Now, you need to understand, when you schedule an appointment, the office has 15-minute blocks, 30-minute blocks, typically for new patients, and sometimes something a little bit longer, depending on the complexity of things. In our office, as primary care physicians, we want to make sure that we establish the agenda early of what you plan, the purpose of why you're there. The last thing we want to do is have the physician come in the room, talk to you about your blood pressure, and then as they have their hand on the door handle getting ready to leave, it's, oh, by the way. Now what happens is one of two things. They're either going to have to take more time with you in the office, which is going to put everybody else they have to see for the day, which is typically 20-25 patients, put all them behind, or we're going to have to schedule another visit. This sounds important to you, but we're going to have to schedule another visit to talk about, you know, whatever that situation might be, unless it's something very serious in the moment, like, you know, chest pain or something like that, that would require a 911 type approach. So always write down what you want to talk about. Then you and the physician, or you and the nurse before the physician comes in, should prioritize those things in terms of what's the most important. What needs to be done today, what needs to be done in the future. If you can get that piece of the puzzle together before the doctor even walks in the room, it's smooth sailing after that. The next, well, as I mentioned, prioritize. And then the other thing is, we don't always have, because we're a fairly decent melting pot in Northwest Ohio, not everybody speaks English, not everybody, you know, you might have the deaf population, and that might need a American Sign Language interpreter. You're always entitled to an interpreter, regardless if it's primary care physician, specialist, being in the hospital. So if you don't have someone that's going to be there, you know, let them know ahead of time that you need an interpreter. In the medical field, there's an interesting study or interesting thought process about having family interpret, because She might be my daughter and I don't know how old you are, but for purposes of this, I may not understand very good English and somebody might be, we have a nurse that speaks Spanish in our office and we're Spanish speaking. They might be talking to her in English and interpreting to me in Spanish. But my daughter may be very protective of me not wanting to hear some certain things, like I have a diagnosis of cancer or something else that might be going on. So she might be withholding that information, which isn't fair to me as a patient. But if you have an independent interpreter, they have no skin in the game other than to uphold, a professional standard of why they're hired. And so that just, I tend to throw that little caveat in there. If you are going to bring somebody, bring a trusted person. Like I said, I might love my daughter, I might trust my daughter, but I need to know, just like when we talk about advanced directives and putting somebody in charge of making decisions for you when you're no longer capable of making your own decisions, you want to make sure that that person is going to be the most trusted person in your corner, looking out for your best interests. If you have to cancel an appointment, just give advance notice. It's kind of common courtesy. There are other people, like I said, at the onset of this talk, you call and make an appointment, you may not get in for a couple of weeks or a couple of months, but that person might be on standby. So if you call and cancel an appointment, that might give that person an opportunity to jump in. Just like if you needed an appointment and you had to wait, you'd like to be on standby and somebody give that courtesy call so you can get in. If you have paperwork to complete, please bring it with you. Let the doctor know that you need to have this completed and let them know a time frame. Doctors have different time frames of when they have to complete certain paperwork and get it back to you. But if you're going to give it to them, let them know when you need it by, and find out, how am I going to know when the doctor has this completed? Am I going to get a call from the nurse? Am I going to get a call from somebody in the front office? Do I come pick it up? Is it being mailed to me? Don't assume after you just hand it to them that everything else is going to work itself out, because I've even been victim of that where I didn't follow through on my end. And I'm sitting there in limbo of something that was necessary. So, like I said, there's several ways that those things can take place, but make sure that you have a clear understanding when you leave the office of how those things are going to transpire. What should I bring to my appointment? The number one thing is logs, blood pressure logs, blood sugar logs. We encourage our patients bring all their medications and just bring them in a plastic bag. But that's very important because we need to see some trends. You may say to me, well, my blood pressure has been okay the last few times. You might think that that's an acceptable range for blood pressure or blood sugar, but we need to see if there's any major fluctuations, either too high or too low. Do we need to be adjusting medications or switching to something else? In terms of medications, I say bring every single medication that you are either injecting, inserting, or putting in your mouth, because a lot of times people will only bring their prescription medications. But we all know that when we sit there in front of the TV or we're on the computer or talking to our friends, they'll say, hey, have you tried vitamin E because, it's helped with my skin, or, that. Even if you're taking something over the counter, if it's Advil, Motrin, Tylenol, bring all those things in. It doesn't have to be just a pill, any ointments and things, because two things. We need to, number one, make sure that first and foremost, there's no drug-drug interaction. If you're taking something that you picked up from the health food store, like St. John's wort or rosebud or echinacea or something, we need to make sure it's not interfering with something else that you're on. The other big thing I always tell people is, if you, not just any specialist that you're seeing, but if you've gone to any urgent care clinic, if you've gone to any of these walk-in clinics like CVS or Meyer, just to get a flu shot, any other type of vaccination, COVID, things like that. I would make sure that you write down the dates, because if we haven't received that information faxed to us as primary care to scan in to your healthcare record to get a complete picture of what's going on with you and for you, we may miss that piece. So in the event that you get hospitalized, somebody might be asking when was their last COVID, and if we don't have that information, you're not able to verbalize that at that point in time. It might be something that's pretty important. If you wear glasses and hearing aids, not only bringing those things to appointment, but for primary care physicians is very, very important, particularly as older individuals, that you let them know when your last eye exam was and when your last hearing exam was. Medicare requires your primary care physician to stay up on top of all that so that they remain in compliance with taking care of the whole person. You don't have to let us know the exact date, but if you say, you know what, I did it in June of 2022, and I went to Costco, or I went to, this particular ophthalmologist, our office is going to call them to get a report, because there's certain things that on those reports, beyond how much your vision has changed, that needs to be part of your medical record, and a lot of people don't realize that. Bring something to write on. Most of the time when you leave, you're going to get something printed out to you called an AVS, an after visit summary, that outlines what your vitals were, what your weight is, confirming your meds. That's the other thing about specialists. If you see a specialist, let us know when you saw them, because Mercy, ProMedica, Toledo Clinic, McLaren St. Luke's, University of Toledo, they all have different electronic health records that don't talk to one another. So we may not necessarily have access to something that you saw for a specialist on a different campus.
Are they working to unify that?
It's all about money.
Okay.
So
I just say no, because my husband does Mercy because he had cancer. So he does a lot of Mercy, but he went to pain specialist here, and they were able to bring up.
because that particular person has access and privileges, might have access and privileges at some of the other facilities with the username and password. However, a perfect example is I go to 3 different nursing homes, and they all use something called point-click care, which is the electronic health record for nursing homes. They all use it, but none of them interface with one another because they're all on different servers with usernames and passwords. So the biggest electronic healthcare system in the medical field is Epic, but my Epic may not necessarily work with your Epic. So, yes.
And also the aftercare paperwork, that's becoming less and less.
It's becoming less and less, and you raise a good point. And thank you for bringing that up, because a lot of times they may just put that information, send it to your email. Some people choose to have what they call a patient portal.
Yeah,
Right.
I hate those. I never can get into.
I don't like them either. I'm a tangible person. I want to be able to leave the office with something in my hand.
Yeah.
And I've said this before to individuals, that after visit summary, I don't want you to go home and put it in a pile of papers. If you've heard my talks before, my take home message is put that after visit summary somewhere, either on a magnet on your refrigerator or somewhere with your other important papers, in the event that 911 needs to be called, or you need to go somewhere emergently. You can just grab those papers because it has the most up-to-date information about you. And when you're in crisis mode, because you're not feeling well or something else is happening, the last thing you're going to do is remember little details of what dosage of a blood pressure medication you're on, or something else. So having that information right there, I think is very useful for individuals moving forward, not just at the time of their visit. What should you do the day of the visit? Arrive early, just because sometimes they have to update your HIPAA form and confirm, is this the right? Even if you were there 2 weeks ago, they're still gonna ask you, do you still have the same insurance information? Yes. Do you still live at this place? Yes. Is this still your phone number? Yes. But they might have to have you sign the HIPAA, which needs to be done annually, just making sure that we are doing things to protect your personal healthcare information. The other thing is making sure that we have the right emergency contact for someone, because that might change from time to time. And make sure you understand that, on the date of visit. My other take home message is make sure that when you leave that examination room, you have a clear idea of what the physician has said to you. And I say physician, I don't mean to exclude advanced care practitioners like nurse practitioners and such, PAs. But make sure you have a clear idea of what they've shared with you of their findings and what the follow-up plan is going to be, so that you don't leave and you get home and your significant other or your family member says, well, how did your visit go? Okay, what did the doctor say? I don't know. Apparently it's on my paper. I mean, that happens all the time. My son does that to me and it drives me crazy. So, and then make sure that you have a plan if there's some testing of where to go, even if it's a blood draw. In this day and age, things change so quickly of blood draw sites opening and closing, and where you can go for an X-ray or a mammogram or a CT. Make sure you have that information. The other thing is pertaining to CTs and MRIs. Know ahead of time whether or not there needs to be a prior authorization for this procedure or that film to be done. Because the last thing you want to have done is going in, getting it done, then all of a sudden getting a bill for $3,000 for an MRI because nobody bothered to pre-approve it on the front end. Now you're having to make phone calls and fight, and a lot of the times the billing people are going to send it to collections right away, and you've got those people involved now. So there's a lot of things that you need to be cognizant of on the front end to not have to deal with the headaches on the back end. The other thing is, you may need to call your doctor's office after an appointment for medication needs. Please let your doctor know at the time of your appointment if you need any refills. Physically look at those bottles down in the lower left-hand corner, and it says refills. It's either going to say 0, 1, several. Know that a couple of weeks ago, the FDA changed things of how certain medications can be prescribed. So during COVID, we all got introduced to telehealth, where you sit in front of the computer and your doctor's talking to you. Okay, I will refill this, that, and the other. Now there's new regulations in place saying for certain types of medications, namely narcotics, opioids, people that take medication for ADHD, hyperactivity, and that there's certain medications that they will not allow as much frequency for refills by telehealth. So if you're somebody that got really comfortable with just seeing your doctor over the computer and you're on certain medications, know that you're probably gonna have to get into the office. If you haven't seen your doctor in over a year and they just keep refilling your meds, that's poor medical care, in my opinion. Your doctor should at least be laying eyes on you physically at least once a year to get a good grasp of what your baseline blood work is, what your blood pressure is, what your weight is, to see if there's been any fluctuations. And the other thing I say is be honest with your physician. I know so many people when I see patients and they're there with their significant other, I love it when the significant other is there and has no filter, because they're not gonna lie. Well, you didn't tell them about this and you didn't tell them about that. And that's my favorite. It is like a lie detector test sitting right next to you. And I appreciate that person might sound like a nag, but they really love you and have your best interest at heart. And they're doing it for the right reasons, but be honest with the doctor. If you've been having some pain and you're like, you know what, I just think I have a pulled muscle and yeah, it's making me breathe a little heavier, and yeah, I'm having a little bit of pain. It kind of is now going down my arm, but I still think it's a pulled muscle. So I'm not going to say anything to the doctor about it. And it ends up being a more serious heart-related condition. This all could have been avoided had you been a little bit more forthright about how things are. I mentioned about going to ER and specialists, and letting them know of any significant changes again in your phone number, and that there are some people who our office does home visits. You know, not everybody's able to come into the office. Not everybody is computer savvy. We do some home visits. But there are just different ways for, again, the expectations of you for your physician, of your physician for you. And that's kind of it in a nutshell. Any questions, comments, experience? Yes.
Is the MD like maybe halfway on the way out? I mean, so many people are seeing the nurse practitioners or the physician's assistant instead of an MD.
That's a darn good question. And thank you for bringing that up. So in our office, we train individuals who have left medical school, come to us to become primary care physicians. We both have MDs and DOs, doctors of osteopathic, which can do manipulation, which you always want to have a DO in your corner. Now you're seeing a lot of what they call advanced care practitioners. So your nurse practitioners, your PAs, a lot of times when you go to urgent care clinics and that, they're all staffed by them. It allows the Medicare guidelines say you're allowed to have these types of individuals in your office as long as you have one MD in the office to help supervise and for them to precept anything that might be of importance. I'm gonna pay you three a lot more as nurse practitioner, a lot less as nurse practitioners or PAs than you're gonna pay me as a physician. So that's kind of where some of that has gone. I see a nurse practitioner for certain things pertaining to my healthcare. I'm perfectly fine with that, but I also see an MD pertaining to my primary healthcare. So at least try and, everybody's different. Everybody has their own preference and their own comfort level. I say at least have one of those individuals on your own patient care panel that you have available to you. But the advanced care practitioners pretty much have the ability to do anything except probably sign off on a death certificate. So that's basically it. Yes.
It's been a while that I had to go to a specialist office, and of course you go to the registration desk,
Right.
give your name and address and all, you know, the basics.
Right.
And then someone meets you at the door to lead you to the examination room. And they ask you your name, your birth date.
Right.
And then before I get to see the specialist, I get, you know, I don't know the medical ladder, and I get asked the same question. Is that a practice or is there
That's
a reason?
1000% called a good practice. Because we want to make sure that we have basically two identifiers, your name and your date of birth.
Okay.
Before that healthcare practitioner opens up that computer and starts to type in anything, they're gonna ask you, even when the nurse rooms you, they're gonna ask you your name and date of birth. That's just good practice anymore. Because if your name is Jane Doe and her name is Jane Doe, we want to make sure we have the right Jane Doe. I mean, that is what we call, there's a big governing body out there called Joint Commission. And their sole practice is to make sure that there's good healthcare practice across doctors' offices, hospitals, extended care facilities. So you should always be getting those types of identifiers.
I appreciate that explanation because, you know, when you're asked 3 or 4 times, I'm going, don't you talk to one another? You know,
That's a very good question.
you know, kind of a
And
thing.
the answer is no, they may not necessarily have talked to one another, because the nurse just roomed you and the doctor's already in another room, and all they see is a flag up on the door that says this patient's ready to be seen. So I didn't talk to you about anything. The only time that nurse might speak to that physician before he or she goes in the room is, I just want to let you know, she's also has a primary complaint of this as well today. You might want to take an extra couple minutes to look at that. So hopefully that
And
helps.
you know what, let me just say, that happened to me. I went to a new dermatologist last year. And I was sitting there a long time. Somebody else came in named Nancy. You know, I ended up, it waited a long time, so I got to go to the bathroom. While I'm in the bathroom, they came out and asked for Nancy. Nancy went back. They thought it was me. They went through a whole bunch of things, and pretty soon they came out and they said, Nancy. I said, and they did explain to me that they pulled the other Nancy in before me.
Now that's a HIPAA violation. And if they don't report that or do something to try and correct that, they could be in violation and get potentially fined. So
But don't they usually just ask first names when they come to the waiting room, don't they?
they will, but that's why once you get into a more private setting, they're gonna confirm what your date of birth and that is as well, that second identifier. To make sure that we have the right person. I don't want to take too much time, but my ex-wife was guilty of that, and she ended up getting some test results that weren't hers and informed that she had breast cancer, and she was beside herself and went in and then realized they gave her, because they didn't use that second identifier, and this was 20 years ago, but I'm all for it, so there
Well,
you
no,
go.
I appreciate that because, like I said, it's been a while, but I just found it irritating, like,
Mhm.
don't you co-workers talk to one another, you know?
Once you get an idea of the
That-
bigger picture,
Yes.
it makes sense.
Yes, yes.
Any questions from anyone online?
No.
Okay, thank you. Hopefully you found some of this information helpful. I appreciate your time. Next month, Dr. Maygray will be here with me. We're gonna talk about Parkinson's disease. In the meantime, enjoy the sunshine. Hopefully the weather starts to warm up. Have a good month. Thank you.
Thank you for your time.
Thank you.
Question about that
Absolutely.
for next month. I don't, I mean, no one in my family that I'm aware of has Parkinson's,
Mhm.
but